Yes, so we have a total, as of yesterday evening, we have a total of 34 cases, and we'll encourage the public to check out the Cumberland County COVID-19 website for updates by 6 o'clock each day for a case count update. We also have demographic data available on the website now, so we have information about how many cases by age and by gender, and hopefully we'll be able to share more information next week. They're all separate cases. Every case is a little bit different. We do know there's evidence of community spread in North Carolina, and so we'd encourage all residents to practice those precautions. We want you to stay home. If I've ever said that, if I've said it before, but I'm saying it with even a stronger message now, we need you to stay home unless you're seeking essential services or unless you're a healthcare worker or a first responder or you're seeking food. We need you to stay home because we do know there's evidence of community spread in North Carolina. Community spread is where we don't know where cases have contracted the virus. So many times we can associate it with travel or another positive case, but when we don't know that, we call that community spread. They might not have traveled to overseas or to another hotspot area. They're here in our community. They don't have a connection to a positive case, so they received it somewhere in the community, but we're not sure how they contracted the virus. So we know that we're getting an increased number of calls from the public. We know that the public is fearful. We know that there is some anxiety going on, and that's normal during a pandemic situation. And we'd urge people to check our website for credible information. We certainly get those calls from anxious neighbors and anxious community members, and we are working as your health department to get information to you as quickly as possible. We don't know when this is going to end. The experts are anticipating that this will peak in April, but we also want to make sure that we are prepared for whatever might come in our community. So I want to emphasize, we keep talking about the peak. If it peaks in April or peaks in May, we're not quite sure yet. But when it does peak, we still have to go down the hill, right? So that means we still will have cases even after the peak, and we still will need to respond to those cases and those individuals. So we keep talking about flattening the curve and spreading that curve out so that peak doesn't happen all at once. We want to slow that down. I try to manage our schedules so that sometimes I have lots of meetings on the calendar and sometimes I don't because we have to be prepared for whatever comes through the day. We typically check in we have a team here that is working, we call it our epidemiology team, and they are really working to do all the contact investigations, so we check in with them on a daily basis. We have an emergency operations center that's up and running down at the county, and so we check in with them on a daily basis. We check in with our city leaders and our county officials on a regular basis, and then also our community partners. There's many agencies, long-term care facilities, those that are working with the homeless that we're checking in on a regular basis to make sure that we're getting information and the most updated guidance on a regular basis.